Yeah, so before going to our HPI, yes, let's have that opening statement, which is very useful. For example, this patient has a known chronic condition. So this is a known lung cancer patient diagnosed 6 months ago on chemo and radiotherapy. Do you see the importance of this statement? The first thing it tells about the chronic condition this person is having, which may also influence our diagnosis at the end. But at the same time, it captivates the examiner that you're able to pick this up and put it down when it came to history taking. So after that, we go to our history of presenting illness. That's where the fun starts. So we're going to use the same thing with Dompara, since our patient does not present with any pain. So we'll just use Dompara. And how is it going to be for this patient? So we're going to have a statement like, the patient was apparently well until 6 days prior to admission. Well, he started to experience a gradual onset of awareness of heartbeat. It started slowly and later progressed. This condition was aggravated upon doing strenuous activities and exercises, but was relieved upon resting. This condition was associated with tiredness, shortness of breath, dizziness, chest pain. Yeah, so you have these associated symptoms. So after this, we have to think of diseases which almost mark with the same type of symptoms. You see, so you think of maybe hypertension. You might think of malaria because of the extreme tiredness, fatigue, and also the way the patient is, the condition. And then you might think of other lung diseases. Of course, you might think of TB, pneumonia. This is mainly due to what? Due to shortness of breath and chest pain. So you have these type of diseases, and then you can just go around maybe other types of diseases which might also, yeah, exactly. So we're supposed to rule that, or we're supposed to rule all these diseases out. So there comes a part of the important positives and the important negatives. So I want to rule out hypertension. I'll start by saying there's no history of hypertension in the family, no history in the family. And the patient does what? Exercises. So
no smoking
it's
too.
going to be very hard for it to be hypertension and has never had such episodes, as you can see. And then you go to maybe malaria. So how are you going to rule out malaria? So malaria, you're going to rule out first on the symptoms and also the risk factors. So on the symptoms, you're going to say no vomiting, no, what is it? Yeah, no vomiting, no joint pain. What else? There's no sense of any confusion of altered behavior. What
No
else?
fever.
Yeah, no signs of fever. That's in terms of the signs. But then you're also going to rule out those risk factors. Sleeps under mosquito nets, and the home is well kept, no bushes or what. So after that, you're going to also rule out TB, you see. So tuberculosis, how are you going to rule it out? Maybe there's no history of weight loss, there's no history of night sweats, there's also no history of coughing of blood. You've also ruled out TB. And then you want to rule out pneumonia. You're going to say the same, but you're going to just add fever in it. And also, don't forget, no history of any other chronic illnesses, because someone with HIV is prone also to get TB. And so you already managed to rule out all these diseases on the way. So I hope you can see how simple that is. So after doing this, the most important thing that actually comes right now, we actually go to various complications. Yes, I mean, before going to complications, let's go to find the risk factors. Or we're going to look for the cause of that anemia. So we already know one of the causes might be the chronic illness that the person is having, and which is lung cancer. But at the same time, he's receiving chemo and radiotherapy. Chemo and radiotherapy has a great tendency of also leading to anemia due to the fact that
Radiation beam does not only affect the cancer cells, but the surrounding cells which are useful to the body. And also radiotherapy causes bone marrow suppression.
I'm going to show the risk factors of anemia. So anemia is one among the hardest ones because it has a lot of risk factors that you're supposed to explain. So it normally has a very low HPI. So one among the risk factors maybe you might start rolling out: no history of trauma, no history of presence of blood in stool, no history of vomiting blood, no history of sickle cell, no history of no history of long-term medication, no history of infection such as malaria. What else can also be here? So anything which also goes, also the diet, and diet good in quality. So you see, we have taken the nutritional history and put it here. And also don't forget, no history of any blood transfusion. So I hope you can see now, and these are our causes. So we're going to rule out. So if all these things are here, so that we can now say, okay, fine. So these are not the real causes of anemia, because in order to treat anemia, you have to treat the underlying cause. So that means we're just left with that our lung cancer, it may be due to the treatment with lung cancer. So what do we go now after here? So after doing this, you're going to go to something called the complications. Complications. So what about the complications? You're going to look at the complications of anemia and also the complication of the of the lung cancer, because this is also part of our diagnosis, the complications of lung cancer. So anemia can lead to heart failure. It can also lead to lung problems. Exactly. So you might get all those respiratory diseases. They're going to also be there. So you're going to rule out all these things. You see. But then you have to rule out the lung cancer. So in the lung cancer, you have to go to the complications. So one of the complications of cancer is metastasis. So you're going to now check how far is the cancer metastasized to, because it can be newly diagnosed, but then it's diagnosed stage 3 or 4. As you know, cancer is silent. So you might find by the time that you know, it has already reached to many other areas. So looking for the metastasis. So what questions are you going to ask the patient? So it has places, it metastasizes to various organs. So it can move from the lungs, it can go to the brain, it can go to the abdomen, it can go to to the urinary organs, urinary tract system. It can affect the liver, and what else? The gallbladder. So all these actually here. So you can ask about any history. Maybe there's the patient present with any history of convulsions, altered levels of behavior, loss of consciousness. You wrote brain metastasis. Then you go to your urinary system. Maybe there's the patient present with presence of blood in the urine. There's the patient present with difficulty in urination, or there's a present with presence of blood in the urine. You see, so you've ruled out all those things. So after that, you are certainly sure that even this lung cancer is in stage 3 or 4, because in stage 3 or 4, that's where you have something called metastasis. Yes. So after that, you already have the complications, and then you finish LPHPI by telling us the treatment that this patient is getting. So you just say, you tell us that currently the patient is on chemo and radiotherapy. And then you can also tell us that the patient maybe is receiving blood transfusion as for today. You see. So you already have all your things which are covered in your HPI, as you can see. We covered about how you amplify the symptoms. We covered about the HPI. We also covered about complications, risk factors, together with the treatment pattern. So, if you write it in this way, and the examiner fails you, that examiner has personal issues with you, but you just get a clap if you do all the things that we have actually said.
Let